Hello everyone, Diana here for Freedom Fighters, and it's Friday, Fabulous Fridays, April 30th. Today's question has to do with bulimia, and it's medical complications of bulimia, and this week it's kind of our special week all about bulimia. So I have a big list of medical complications, and I'm just going to start listing them off for you. The big ones I would say are electrolyte imbalances, and this can be really scary just because, like, people that have electrolyte imbalances, they don't really know it. It doesn't like show on the outside, but then all of a sudden you can faint or have a heart attack or even die just because your electrolytes are all out of whack. Another one is broken blood vessels in the face and bags under the eyes. And this is mainly due to purging, just because as you try and purge so much, you can break blood vessels in your face and eyes. Dehydration is another big one, just because a lot of the water that your body has comes from your food, and if you're always purging your food, you're not going to have as much water as you need. Fainting spells. This is kind of due to the electrolyte imbalances and just not having enough nutrients. Tremors, shaking, if you are purging and binging and purging and doing it multiple times a day, you're going to start shaking because your body's going to be all out of whack. And blurred vision, I think that's more due to purging, just because, like, if you stick your finger down your throat and stuff, it's not going to do good things. Indigestion, this is due to the binging and purging cycle, as your body gets all out of whack, since, like, you don't really have any nutrients in you. You can't, stuff is going to start trying to come back up, and not good. Cramps, abdominal discomfort, bloating, gas, and constipation. Internal bleeding and infections. Internal bleeding is mainly from your esophagus and your throat, and all of that, just because as you purge, there's acid that comes up, and that can really damage your esophagus. And then infections, just because you have germs in your hands and you're always sticking your hands down your throat. Laxative dependency and damage to the bowels. Laxatives is another way to purge, and if you take laxatives day in and day out, your body will become dependent on them, and you're not going to be able to have a bowel movement unless you use laxatives. So liver and kidney damage, along with things like acid reflux, peptic ulcers, and pancreatitis. Pancreatitis kind of deals with, like, your kidneys. Loss of tooth enamel and from repeated vomiting, and mouth sores and tooth decay. And this is also just because there's, like, acid every time you throw up. So the acid and the food particles are going to decay your teeth a lot. Suicidal depression is also another medical complication, just because people with eating disorders usually are depressed, and suicide can be kind of built in with an eating disorder, I guess you could say. Swollen glands in the neck, under the jaw, and chronic sore throat. And this is also from binging and purging. Some people feel that they kind of look like a chipmunk after they binge and purge. And then sore throat is just from, making yourself throw up all the time. Upset of the body's fluid mineral imbalance, and possibly causing rapid or irregular heartbeats or even a heart attack. When your electrolytes are all imbalanced, it really plays a big part in how your heart is performing. And if you don't have the right electrolytes, your heart is going to kind of try and make up for it by beating irregularly. So weight fluctuations from alternating diets and binges. People with bulimia actually usually are average weight or a little heavier, just because they binge and purge, and every time they do eat, their body kind of turns it right into fat, just because they think they might be in starvation mode. Rupture of the esophagus and the upper gastric tract, just because of all the acid, and this can actually be a cause of death of bulimia. Weakness and dizziness, again from the electrolyte imbalances. And loss of menstrual periods. That's mostly due to being underweight, or people with eating disorders usually lose their menstrual periods a lot. And then the regular use of ipecac syrup, a medicine used to induce vomiting, can be deadly. And it's particularly dangerous because it builds up in the body over time and eventually can damage the heart and can lead to a sudden cardiac arrest. And an example of this happening is with the case of singer Karen Carpenter, and her death was actually attributed to ipecac abuse, just because she used the medicine so much, so her heart eventually gave out. Alright, some other effects it has is on your brain. Bulimia can cause depression, fear of gaining weight, anxiety, dizziness, shame, and low self-esteem. As far as your cheeks, it's swelling and soreness. In your mouth, you can get cavities, tooth enamel erosion, gum disease, teeth sensitive to hot and cold foods. Your throat and esophagus can be sore, irritated, can tear and rupture, and there can be blood in your vomit. And you're obviously going to have fatigued muscles. In your stomach, you can get ulcers, pain, and your stomach can rupture and delayed emptying. And your skin is going to be abrasive on your knuckles and dry skin. You can have anemia, and your heartbeat can be irregular, and your heart muscles can be weakened, heart failure, low pulse, and blood pressure. You can have dehydration, low potassium, magnesium, and sodium. Those are kind of the electrolytes. In your intestines, you can be constipated, regular bowel movements, bloating, diarrhea, abdominal cramping, and so on. And like I said before, you're going to have irregular absent periods. So yeah, this video is just mainly about all the different medical complications, and it's meant to be informative, just because a lot of people that have an eating disorder don't necessarily know of all the complications. When I was anorexic and getting treatment, I didn't know about all the complications until a doctor actually told me. People don't tell you that you can die of a heart attack from anorexia, and your skin is gonna turn yellow, and you're gonna have little hairs grow on you, and constipated and all that. No one tells you that. People just automatically think that having an eating disorder is an easy way to lose weight, and there's nothing wrong, nothing's gonna happen, but that's not the case. Eating disorders are very dangerous, and they're not a lifestyle. They have a lot of medical complications, and you can die from them. So I hope if you guys have bulimia, or someone that has bulimia, or maybe you're just getting into bulimia, I really hope you can get yourself treatment, get help before you have to deal with all these consequences of the disease. So if you guys have bulimia or know of anyone that has it, please get them help right away. Alright guys, see you next week.